Thank you, Dr. Pasna. It was a nice and elaborative description of what all is mentioned in the module. So just to sum up, as Dr. Pasna has said, 2 electives, block 1, block 2, block 1 in the pre and the paraclinical subjects, block 2 in the clinical subjects, and in block 1, the clinical posting in the clinics would continue from in the regular hours, while in the block 2, the clinical posting will not be there. The whole day the students would be in the elective posting itself. So we'll take up any other questions or other queries. You can keep noting down because some of the answers will come in the coming slides. So now launching this program is unique to every institute. NMC has given us certain guidelines. This is my screen visible?
Yes, ma'am, it's visible.
Thank you. Is it moving also?
Yes, ma'am.
Thank you. So here at AIMSR, we also have thought of something and we have started the planning how we are going to implement this program of electives. So from the MEU department, I'll be just giving a small presentation of what has been done till now, how we are planning to do it further, and how you all would be involved in this program. So we are here today in January 2022, coming, it would be February, and we have to implement the electives program for the 2019 batch, which would come as MBBS Final Part 1 in February 2023. So which means that our first batch of electives would start from 1st of February 2023. So these students would be presently in, they are undergoing their second phase exams and they will be going for their 1 year in MBBS Final Part 1, right? So we have this 1 year for preparation, and this is the brief timeline which we have planned out, chalked out for our own institute, right? So here you can see that the yellow arrows, we are here today and we are undergoing this faculty training workshop, and you all must be wondering how we have achieved or how we have displayed your names in the list that these are the faculty who have been identified. So just to clarify all these things, we started this process early in October 2021. So whenever we have to launch any program, any new thing is coming up, we always need to do a needs assessment survey for that program. And NMC also has told that it is your students and your faculty who will be deciding that what are the electives you are going to start for your own institution. So in October 2021, we did a needs assessment survey. All the students of 2019 batch, all the 150 students, they were sensitized about this elective program, and a Google form was circulated to them. 128 students responded, and there were a few questions in that in which they had to give their views on what electives they want. So a list of electives were given to them and they had to mark 2 options which they preferred. So this way we arrived at a lot many of the electives names which these students proposed. At the same time, we also sent the forms to our alumni students, because you see, always when the students are going out of the institute, then they realize the importance of what the electives they should have attended in the undergraduate field. So we received some responses from our alumni students also. They were also taken into consideration. And many of you were a part of the discussions which were held. We held 2 focus group discussions. The first was for block 1 with the faculty of the pre and the paraclinical subjects. And we had a second focus group discussion with the faculty of the clinical subjects. Mainly the HODs or the acting HODs were included in that FGD. And after doing all the analysis of all the answers of the students, the alumni and the faculty, we were able to develop a list of intended electives. So I will mention here that it was a list of intended electives, and we tried to identify the preceptors, or we can say the faculty who would be responsible for implementing those electives. So this is what, just to make the size bigger. So this needs assessment thing has already been done, right? So this is how we achieved whatever we are writing in our list of intended electives and the preceptors. Now, in the meantime, an electives core committee was constituted with Principal Sir as the chairperson, and we have our Dean Academics and the MEU coordinator along with 3 other members. So this is the elective core committee, which is further responsible for all the implementation and carrying out the further progress of the implementation and evaluation of this program at AIMSR. Now, these all things we did, and we gave you a list of intended electives and preceptors, which was circulated in December. And today in January, we are conducting the faculty training workshops. We actually plan to do it in 2 parts as a hands-on workshop, but due to COVID, we could not do. So we are doing it in the online form. Anyways, now your work starts. The departments have to prepare the modules and the plan of implementation in February 2022. So you have full 1 month of February where you will be preparing the modules for your own departments and how you will be carrying out those modules, what the students would be doing. The logbook thing will be taken care of by the core committee. We will have a common logbook, which will be same for all the blocks. But what has to be filled in those pages, that will be decided at the departmental level, right? So this is what is now your role starts in preparation of the modules. And today we are basically going to discuss this only, that how the modules are going to be prepared. After you people prepare these modules, validation of the modules is very important. So you all must be thinking why we have started so early. Abhi to 1 saal pada hai shuru karne mein, to abhi kyun modules mang rahe hain? So we need to do a lot of things more before actually starting these electives. So the validation of the modules would be done by the curriculum committee, and then we will publish these modules, because based upon your modules, we would be able to make the SOPs for allotment. Until we have the actual number of the modules, the number of students that you people would be accommodating in your departments, we cannot make the SOPs, because all the 150 students have to be allotted one or the other elective, right? So we hope that in March month of 2022, we will be able to do this thing. And when these students, the NMC guideline says that when the students join in MBBS final phase part 1, we have to display the list of electives and sensitize these students. So when these students come to us in March, we will have the final list of electives. So many of the people were asking us again and again, कि ये हम change कर सकते हैं या फिर preceptors change कर सकते हैं. So this is what you people are now going to do. When you make the modules, you will realize that you might need to change some of the things, you might need to add some more people to it. So once you give us the final modules, then we will be able to make a final list of electives, and that will be displayed to the students in March 2022. After that, it will be the office work of the getting the applications from the students, going through the counseling process and reallocations, and final list will be displayed before the students finish, sit for their final phase part 1 exams. So these students are going to sit for the exams in January. So before that, we have to display the final list, that which student is going to go into which elective. And we start the electives in 1st February. So the month of February 2023 would be block 1 electives, and the month of March 2023 would be the month of block 2 electives. I think with this, many of the things are clear now in your mind, that how we will be going to proceed. This was the list of intended electives and preceptors. So you all must have gone through for the block 1 and the block 2. So there is I would say that this is the list of intended electives, right? So you can change it, you can modify it, and you are free to develop any more modules that your department wants to offer, right? So we have tried to identify, you must be seeing that for some modules, we have written only the name of one preceptor. For some modules, we have written the name of 3 preceptors. So these can be changed at your departmental level, but this is the bare minimum which we require because we have to adjust 150 students, right? So you can always have more numbers of modules and more number of preceptors, which would be made available from your departments. So this was the list for block 1 electives, and this was the list for block 2 electives. So you can see obviously in block 2 electives, because we have the super specialty clinics in our hospital, we have an advantage of offering more electives to the students. So with this, I will again hold the process here, and I hope all of you are with us.
Yes, ma'am.
Yes, ma'am.
Okay.
Yes, ma'am.
So does it make some sense that why we are holding this elective workshop at this point of time?
Yes, ma'am.
Yes, ma'am.
Thanks a lot. So we will continue further, and now we will try to explain to you how you have to make these modules for your electives. So that's why it was kept open for the other faculty also to join, because they also need to be trained, because we might include them. And please mind it that this electives list is only for this year of 2019. Every year we might add to this, we might need to remove some of them, or based upon our experiences, because we are also doing it for the first time. So we might need to increase the number of electives, or we might have more opportunities to offer to the students. So now we will go to the second part, that how a module has to be prepared by you. Now, this is the part which you people are going to do. So I would request all of you to listen to this carefully. So we'll continue with Dr. Mandeep. She will, Dr. Mandeep, I'm making you the host.
Yes, ma'am.
Yes, over to you, Dr. Mandeep.
Yes, ma'am. Thank you so much, ma'am. Just give me 1 minute. Ma'am, is it visible? Hello?
Yes, Dr. Mandeep.
Okay.
Visible. It's visible.
And my slides are moving too?
Yeah.
Okay, thank you so much. Good afternoon, everyone. So let's begin with this discussion on module development, the very important part of electives. So my learning objective is that at the end of the session, you people should be able to know how to develop the module for the electives. So what are the various components that will be there in your module, which you are going to frame? So what are the different components? I will discuss each component one by one. And for that purpose, I will be showing you the template for planning the learning experiences in the electives. And this template is actually already there inside the that PDF that has been published by the NNC, this elective PDF. So that is already there. So this is how this template will look like. So these are the further components of this template. So under these subheadings, you people are going to prepare your entire module for the electives. So let's begin with the very first thing. That is the name of the block. So as explained by Dr. Upasana about block 1 and block 2, pre and paraclinical, they will be included in the block 1. And your clinical sciences and the community clinic, that will come in the block 2. So accordingly, the one you are offering, you are going to write down the name of the block, either block 1 or block 2 beneath this particular component of the template. Then coming to the next one, name of the elective. So whatever name of the elective is, as we are already having in our hand the list of intended electives, they are the intended electives. Definitely, if you think that more number of electives, they can be added, you can definitely add that. Okay, so accordingly, for example, my department is going to offer the module, this elective of ADR reporting. So I will write ADR reporting that as a name of the elective. Then coming to the next one, next component, that is the location of the hospital lab or the research facility. Now, where you people are going to conduct your electives. So this is important. Accordingly, you are going to mention the location. So suppose the pathology people, they are offering their electives in the pathology lab or in the central lab or in the virology lab or whatever is the location. For example, for my, I am writing Department of Pharmacology. So accordingly, this location can be decided by you people, and that can be the part of this location of hospital lab or the research facility. Now, moving to the further this name of the internal preceptors. So you are having list of intended electives along with the list of internal preceptors. Now, who are the internal preceptors actually? So they are the people from within the institute only who are going, they will be from your department only, and they will be the one who will be involved in guiding the students. So they will be supervising the students, they will be guiding the students. You are having that list. If you want to add more number of internal preceptors, definitely that is your choice and you can add that. So accordingly, you're going to name those internal preceptors. Moving further to name of external preceptors. So external preceptors are basically from outside the institute. So name is external preceptor from outside institute, and particularly if you think that a particular facility is not available at our institute, if you're thinking that way, then you can give the name of the external preceptor. So moving further to the another component, that is the learning objectives of the elective. So here you people are going to enlist or enumerate all the learning objectives that will be there of your elective. Like my elective is ADR reporting. Accordingly, I will enumerate all these learning objectives in this particular subcomponent, the component of this template. And actually, this is something which is very similar to what we have done in the past. This NNC gave us all these competencies, and accordingly, we have framed the learning objectives. It will be very similar to that exercise only. The same way we can frame our learning objectives of the elective. Then moving further to the other one, number of students that can be accommodated in this elective. So we are having the internal preceptors with us. So accordingly, internal preceptors, they can be tagged with the minimum number of students. Suppose I want to accommodate 2, so I will write against my name 2 number of students. My co-colleague, she is going to, she's also a part of this particular elective. So she can also, depending upon the number of students we want to guide or we want to supervise. So accordingly, that number is going to be written over here. Then moving further to the prerequisites for the elective. Now, this is very important. The prerequisites, what you want, what you expect actually from your students. That is important thing. So suppose if the electives, they are being offered by the plastic surgery people, they want that the students, they shall be trained in the basic suturing skills beforehand. So if such type of prerequisites, or if the electives, they are being offered by the pathology department, so they want that students, they should be beforehand trained in the good lab practices, GLP. So accordingly, you people are going to decide what prerequisites should be there for your electives. So this is you people who are going to decide that. Moving further to the learning resources for the students. So learning resources, again, that can be anything. That can be the textbooks, handbooks, or they can be the modules, or they can be the internet-based resources, whatever. What you feel is they can serve as a very good learning resource for your students whom you people are going to guide. You can add over this particular component of your module. Moving further to the list of activities in which the students, they will participate. Now here you people are going to enlist all the activities which you people will be expecting your students to perform or to participate during the entire period of 1 month. So the students, they will be there with you for 30 days, right? So for that 30 days, what all activities you want your students to perform? Or what you want your student, they should participate in which all activities. So you people are going to enlist that, and better would be you enlist according to the days. For example, from day 1, 2, 3, you want this particular activity. Then on 4th day, this is some other activity. Accordingly, you people are going to enlist all those activities in which the students they will participate. Right. So this will be dependent upon your learning objectives and accordingly. Moving further to the portfolio entries which are required. So portfolios, it will be the compilation of all the material that during that entire training period, what student has done. So that will become his portfolio. Okay, so it will be actually an evidence to what we are going to document in our logbook. This is important. So it can be, portfolio can be an next year to your logbook. So that depends upon you. So that is what is portfolio. Further, moving to the logbook entry required. Again, actually it has been decided by the core committee that the logbook that will be prepared by us. But the important thing is that what all entries need to be there inside the logbooks, that is you people are going to decide. We cannot decide on our own that what can be the logbook entry. For example, you want to enter SDL, you want to enter seminars, or you want to enter reflections or whatever. So this is preparation will be entire preparation that of logbook will be done by us as a core committee members. But what all entries need to be there inside your logbook, that only you people can decide. So that will be suggested by you people, that will be a part of your module that need to be mentioned under this particular subheading of logbook entries required. Right, so daily certification is must. Logbook is very important thing. Then coming to the assessment part. So the most important thing is 75% attendance. That is the most important thing. So 75% attendance is must, one thing. Another important thing is logbook completion, its certification and its submission with you people. That is the main criteria, only after which the students, they will be allowed to sit in the final university examination of MBBS phase 3 part 2. So that is very important. So these two things, 75% attendance plus all logbook certification, completion, summation. Another important thing about assessment is that assessment will be the formative assessment. Again, you people are going to decide how you people are going to assess your students to whom you are guiding. So that way, depending upon that assessment methods need to be entered into your module. How you are going to assess? You are going to assess on the basis of the participation in the grand rounds, or on the basis of the seminar that was given to your student, or on the basis of the on the basis of any other activity that has been done in your department. So it depends upon you how you want to assess, and it is a formative assessment, it is not a summative assessment. Then coming to the last component of the module, that is other comments. So here in the other comments, any additional thing you want to add, you think that this is necessary for your elective, you can definitely add in the comment section. For example, barriers or any challenges you can face actually while you are going to implement these electives. So that can be added in this comment section, along with feedback of the students. If you want to add, that can be also be added. And if any additional resources you think, yes, my elective need these additional resources, that definitely can be added in this comment section. So that is all with, so these are the different components under which you people are going to prepare your entire module. So that is all with this. So now I will ask Dr. Tanveer to please carry forward. She will explain you with the help of the example from block 1, and later on Dr. Upinder, she will explain you with the help of example from block 2, so that you can have a better visualization of what elective is actually. Thank you.
Thank you, Dr. Mandeep.
Thank you.
So I think now all of you have seen the template. That is what all should be what all has to be included in the module. Now, it doesn't mean that it will be a single table with you people just filling against the names, right? So for that, we have tried to develop some modules for our own, maybe because it was easy for us to develop for our own department. And we will be sharing 2 examples, one for block 1 and one for block 2. And another important thing which I missed in my earlier part, and why these modules are important, is because you are also going to display these modules to the students when they have to make the choices. When the students are asked to fill their choices, or we are going to hold the counseling for them for allocation, prerequisite for that is they should have all these modules with them. Maybe we will be either distributing them as hard copies, or practically it would be more easy if we display all these modules on the university website or on the college website, where the students will go through all the modules and then they will find out which choices they want to fill. Right, so that is why it is very important that your module should have the details of all the things, so that the student understands ki if I go into this module, into this elective, what activities I will be doing, or what things I would be learning out of this elective. Right, so it is very important that your module should be so much explanatory and so much clear that the students are able to take decisions. And of course, they should be a little attractive also, that the students find it, they want to take up that elective. So I will be sharing my screen again for moving further. Is my screen visible?
Yes, ma'am.
Okay, thank you. So we move on to the elective module development. So I have tried to develop the elective for block 1. Now you can rename your elective if you don't like the name which we have put, because we have just put the broad name. So you can frame a nice name for your elective. So like we have done it as research methodology and biostatistics. The duration, of course, would be for 1 month. The location, now, first of all, I'll take you through all the points which Dr. Mandeep had explained, right? So then later on, we'll discuss what else has to be added. So going point by point, first of all, the location of the hospital lab for my module would be the Department of Community Medicine and the urban and the rural field practice areas of Department of Community Medicine. Secondly, we have enlisted the name of the internal preceptors. So we have 7 faculty members in our department, each of which will be working as an internal preceptor. They will be guiding the students, right? They all will be involved in the process. I mean, we'll be offering the same elective, but 7 people would be offering this elective. We do not want to have any, I mean, we do not need any external preceptor as yet for this module. So we have made a broad goal or a competency. This is your wish. You can put up a broad goal or a competency for your module. So we want to develop an IMG competent in understanding the basics of research methodology and the application of the acquired knowledge and skills in conducting the scientific research. So by reading this statement, my student is going to understand that what this module is going to give to him. This is the final thing which he will achieve. So he will be able to become an IMG who will be able to apply the research methodology and statistics and would be able to conduct the scientific research. Now I can enumerate numerous objectives, the learning objectives based upon this competency. So here I would like to add that there will be many learning objectives which would be of the K level. I mean, if you remember again the domains of learning, the knowledge, skills, attitudes, and communication. So many of the learning objectives you might have to start from: describe the needs and importance of research, understand the differences. But what is more important, that we have the learning objectives in which the students have the skills objectives. So here we want that students should be able, of course, this K objectives are important before they move on to the further. This is the skill component which we are offering. Construct and plan the methods of sampling, data collection, classification, analysis, interpretation, and presentation of statistical data. So by the end of the this module, the student will be able to construct and plan. I mean, he will be able to do these things. He would be able to demonstrate the ability to use biostatistical software using computers. So he will be able to use a Microsoft Excel or whatever software we are going to decide for the students. He should be able to work in a team and demonstrate communication skills, right? So these are some of the learning objectives which are in the skills, attitude, and communication domain. So though I have not mentioned it here, but it's your wish. If you want to elaborate the learning objectives further, you can also mention the domains further which these learning objectives would be offering. Now, the number of students that can be accommodated, how do you calculate that? Now, I had identified in my department that we have included all the people AP and above as the preceptors, because research methodology is one basic thing which community medicine is doing. So we have identified that all of us will be the preceptors. So we have 7 faculty members. Now, since research can be carried out by students in teams or in groups, it will not be one student carrying out a research. So we can, one preceptor at one point of time can have about 3 to 5 students, right? So, which means the total number of students which can be accommodated in my module would be 21 to 35. So I will be giving this number to the Dean Academics, and then when they calculate that how many students have to be attached to a particular elective, they will be using this number to decide the allocation process. So I cannot just keep it open that jitne marzi de do, right? So I have to give this number, and it is better if you give a single number here. Like if I would have given only 3, so then I can write, I will have students only in groups of 3, and the maximum number of students I can accommodate is 21, right? So that 21 number would be picked up by the Dean Academics when we are deciding on the allocation process. Now, for my module, just taking the example for my module, what are the prerequisites for students? Now, this is also important because when the allocation process will happen, the HODs would be involved, and they would, like, if, for example, there are many students who want the same elective, right? Now, how do we break that tie, right? So if there are more number of students who are opting for the same elective, we need to have certain guidelines or certain criteria based upon which we will be deciding. So we can mention certain prerequisites. So if these things are done by my students, I will be that student would be preferred for this elective, right? So for example, in our department, we are doing the basic training in research methodology in phase 2. So that student should have attended all the classes of that basic research methodology. After that, they are also asked to submit a research project in the MBBS final part 1. So they should have, a student should have the community medicine logbook certified for the research project participation and presentation, because this is what we are normally doing. And if a student has not done it in his phase 3 part 1, we will not be taking him for his for this elective. And preference, now again, if there are 2 students who have done this research project and both of them have a tie, then preference will be given based on the merit of internal assessment in the research project. So jiski research project mein merit zyada thi, that student would be offered the elective rather than the other. So this way you can make any these criteria for your own electives. For example, you can also take a simple criteria of any student who has attended more than 90% classes of pathology. So they will be preferred. Or you can here just remember that the students, when we are offering them these electives, they have not yet passed the MBBS final phase part 1. They're still in MBBS final phase part 1. So if you want to use the marks of university exams, that will be only based upon part 1 and part 2. I mean phase 1 and phase 2. Right? So that pathology or microbiology or physiology people can make their criteria based upon their marks or their merits in their particular subject in the final university examinations, right? So this is what has to be decided in your module, that what would be the prerequisites for students who will be offered your elective. Then you have to give us the detailed learning resources which you will be providing to the students. Now, some of these might be in the form of you can create soft copies of the resource material, or you can recommend certain textbooks, and even from the library you can recommend the textbooks which the student will be using while attending this elective. So it is not that you can leave them as such ki koi bhi book padh lena. So you have to tell them at least a few basic resources which they will need to study during your elective. Now, this is very important. As Dr. Mandeep had already told you, we want to link the learning objectives to the activities. Like I was saying, ki knowledge part hai, skill part hai. So wo skill when I am going to ask the student to do. So the activities have to be linked to the learning objectives, how the student would be achieving that learning objective. So you can see I have made a list of activities for the 30 days. So depending upon the month, whatever it is, it can be a little bit changed, but I have made it something like this. That is for the first 4 days, a modular approach to reinforce the basic concept shall be done in the department. So this, we might be doing it by self-directed learning, or we might use some lectures to teach them again, or the workshop. So for first 4 days, we will be giving a recap of all the basic concepts of research methodology and statistics. Now on day 5, we will be making them into groups. They will be selecting the research topics, and they will be allotted the preceptors. Like I told you that there are 7 people. So which students are attached to which preceptor will be decided on day 5, right? Now day 6 to 8, the students will prepare the proposals and submit them. So they will be given 3 days to prepare the research proposals and submit it. On day 9th, our department will have to arrange for presentation to Research and Ethics Committee, which we will be doing as an extra activity, because none of the students can go to field or to the hospital to conduct any research activity without the permission of the Research and Ethics Committee. So we plan to do it in a quick way. We will be requesting the Research and Ethics Committee to give us the on-spot decisions for those research projects. And when the students clear that, they will be collecting the data from 10 to 15 days. So they will be given next 6 days for data collection. Then for next 4 days, they will be doing the data entry and analysis. And day 21 to 25 will be given for report writing. Now, after they do all these activities, day 26 and 27 will be utilized for presentation of the projects. So this presentation will also be a part of their assessment. And finally, day 28 to 30, they will be asked to give the reflections, which will again be a part of formative assessment and feedback. They will be making future plans with their preceptors. So whatever preceptor was supervising the student, they will sit together and make the future plans, whether they want to extend that research study, because in this 1 month, they might be able to do only in a small sample size, right? So future planning, whether they want to apply that for grants or for scholarships or for publications, etc. So this all will be done on the last 2 or 3 days. So this day-wise listing of the activities is important, because based upon this, the logbook also will be filled day-wise. So like we told you that we will be making a common logbook for all. So that logbook will have 30 pages, right? So whatever activity the student is doing on day 1, the student knows prior to the starting of the elective, कि आज मुझे क्या activity करनी है, right? So he will be performing that activity, and that activity will be certified or will be signed by the preceptor for that day. So a daily entry into the logbook and certification that that day the student has performed that activity will be written by the student and checked by the preceptor. So that is why here the supervision is very important. It cannot happen that the preceptor signs the logbook after 1 week or say after 2 weeks कि अच्छा पिछला सारा लिख ला है, अच्छा चलो अब जाके sign कर देते हैं, right? So that things should not happen in that way. Now for my module, what I have decided that now again, बच्चों को कई बार यही नहीं पता होता कि logbook में लिखना क्या है, right? So that is why we want to give them a complete detail that what logbook entries are required. So here I have enlisted that for my module, a day-wise entry of all the activities will be signed by the preceptor daily, right? So daily, whatever the student does, he will write and the preceptor will sign. Second thing is, we will go for the formative assessment, which will again be entered into the logbook. All the assessments here, because we are doing it as formative assessment only, will be entered in the logbook. So we have planned to do a weekly 360-degree assessment for our students. That is, we will be taking the feedback in the form of a matrix. We will be collecting the feedback because the student will be working in the field, maybe or in some other department in the hospital where he's collecting the data or is analyzing the data along with the statistician. So we will be obtaining the responses of the peers because they are working in groups also, right? So we will be doing a 360-degree assessment every week. So a student will have 4 entries of weekly assessments, a single entry of reflection at the end of the month. At the end of the month, the student Arnav, can you please mute yourself? So the reflections would be at the end of the month. And finally, if you remember, we had put on day 26, 27, the presentation of the final project work that will be done. So that will also be graded and will be entered into the logbook. Now, the certification of successful completion of the module will be done based upon, again, the 3 criteria, if you remember, we had made for our own departments, that is below expectations, meets expectations, or exceeds expectations. So the final certification is only in the form of the final grading, right? So any student who is above M and E would be considered as clear, and below expectations, obviously, then we'll think of some remedial measures which we will be doing. So at the start, because we are giving this module to the student, so he cannot say कि मुझे तो पता ही नहीं था कि इसमें ये entry करनी थी, right? So all these things have to be clear to the student also and to me as a preceptor also. Now the portfolios, as Dr. Mandeep has already explained, that portfolios will be the evidences to your logbook entries. So because my student has done his project work that has been entered into the logbook, I want him to give the evidence in the form of a project report, right? So the whole of the project report will be attached with the logbook as an annexure as per the standardized template of whatever study design the student has performed. I would also like to have all the data records and the performance and the statistical worksheet as an evidence to what the activities were there in the logbook, right? And thirdly, the write-up plan for the further action. That is, the last 3 days we had given to the student to make a forward plan. So that plan should also be attached as an annexure to the logbook. So these are the 3 portfolio entries which we have finalized for our module. You can do it based upon your own module. So it needs not be 3 or 4 or 5. It should be what you can actually make as an evidence of the logbook entries, right? And finally, for the assessment, one criteria is common for all the electives, that is the qualifying criteria of more than 75% attendance. So you can relate to this now when the logbook will be signed every day. So if a student is not coming on that day, obviously for that day, the logbook will not be signed. So more than 75% attendance would be documented in the logbook. The second thing, the formative assessment also, because I told you that it has to be documented in the logbook, it will be documented, it will be marked weekly, the continuous learner assessment on day-to-day basis. The final presentation, we have planned that we will be doing the final presentation of the students by a panel of experts who can be called as judges on the day of the presentation. They can be the faculty from other departments, the dean, or the research committee members. So grading will be done on a global rating scale for the final project work. And finally, the reflection writing will be done on the last day. So these are the 3 things. If the student is attaining the qualifying criteria, has all these 3 things qualified, that is, he makes a presentation, he has all the assessments in his logbook, and he has given us a reflection. Then we will be certifying that student as meets expectations or exceeds expectations, right? So this is the assessment criteria which you have to predefine. You cannot say कि उस दिन देख लेंगे कितने number देने हैं और कहाँ से देने हैं, कहाँ पे लिखने हैं, right? So these assessment criteria have to be planned when you plan the module. They should not be added later on. Now, in addition to this, you can give your modules more innovations or more comments can be added. For example, I want that my students should know why they should opt for my elective, right? So I can tell them, now this module will be developed in the form of a PDF or in the form of a PPT, right? So in that, I would place this page as my first page, right? Why this elective? So the students can go through this. I am entering 2 pages, why this elective and what do I gain as a learner. So by reading these 2 pages, my student will be convinced to take up my elective, right? So I will be telling him what is the utility of the research methodology. You will be able to explore other avenues. You will be able to apply for more research projects, right? So I will be giving some strong statements why my student should be choosing my elective. And they should know what they should gain, they will be gaining at the end of the elective. So I am trying to tell the students, because many times students are not aware that what they will gain from that elective. So this, like I'm mentioning some statements that they can publish the work in journals, it would increase their interest in post-graduation, it will enhance their career progression, they will develop skills like leadership, teamwork, communication, right? So these are various things which you can add, that what the student is going to gain as a learner if he does your elective. So these things would attract the students to your elective. Now, I also want to add some more additional resources, because it is not only in community medicine, but in many other departments also, that only we 7 people cannot do all the work, right? So I will also involve my medico-social workers from the department, my demonstrators, my field staff, and my statistician cum tutor as the additional resources, right? So you will have to write what are the additional resources you are using as personal or as equipment, right? Now here I will be needing computers, and I would be also asking my administration to give us a SPSS software so that we can allow the students, I mean, we can train the students to use that software, right? And other things like vehicle arrangement for data collection from field areas, though we have it, but the permission will have to be accorded from the concerned authorities, right? So these are the additional resources which I need to mention in my module. I can also, I mean, this is again optional. I can ask for a funding support, since the idea of just came to our department that we have a UG research cell, and every year when we do an elective, one best project out of that can be given a small scholarship or an appreciation award, right? So that would be a boost to the students to take up the electives and take up the research projects. Also, additional funding support for external research agencies can be applied for by the student along with the preceptor. And the day-to-day expenses will be borne by the students themselves, that we have to clarify in advance that the research project, for whatever extra things they require for their project, that they will have to bear themselves. Now here, I already mentioned that there was a barrier with us, that how we will be going through the research and ethical permission. So we from the department will ask the institution to arrange for one expedited processing and issuing of approval for the student projects. So we will be working on this. I don't think it should be a big problem. It can be tackled. And finally, I also have to give in my module that how I'm going to evaluate my own elective. You see, every time when we do a teaching or any session, we need to have a feedback from the students as well as the faculty. So we have planned that we will be taking the feedback from both the students and the faculty through pre-validated feedback questionnaires. We are developing it in our department, and these feedback questionnaires we will be using for taking their feedback on the elective when they complete the elective. And we will also be analyzing the reflections which we have collected at the end of the month, right? So we will also be doing the qualitative analysis of the reflections of the students, and we will be able to comment upon the usefulness of our module. So this is another way in which you can present your learning objectives. Like I was mentioning earlier also, you can mention the learning domain as well as the proficiency level. And you can also mention, I mean, if you want to go a step ahead, you can also mention what educational strategy you will be going to use for that learning objective. So I will not go into much detail, because if you want, you can go further. So I have enlisted for all my learning objectives, like which fall into the skill zone or which falls into the attitude zone, how they will be done, what learning method would be used, teaching learning method would be used for that, right? So these you can add if you wish to in your modules. Otherwise, basically simply having the learning objectives and having the activities, day-wise list of activities would be sufficient. So finally, I would like to end by saying that sustainability of the elective program should be considered as an important factor. It should not be कि एक साल चलाया अगले साल बच्चों ने लिया ही नहीं आपका elective. So you should be developing your elective in the form that it is sustainable, and there are always chances of improvement, because we all are doing it for the first time. I have also made this module for the first time, and we will be learning by doing. So improvement will happen yearly, and we will keep on improving on these modules and the electives every year. So thank you with this. And this was just what I could enlist for my department. Maybe for your own departments, you will have your own innovative ideas to develop your own modules. And to continue further, we will take one example of block 2 module from the clinical department. So I would request Dr. Upinder to share her screen.
Okay,
Yes.
ma'am. Thank you.
Good afternoon. Till then, can I ask one thing, ma'am?
Sure, sir. I'll wait.
No problem, ma'am. You continue sharing. I will just have a very small query. So, who is the external preceptor? Is it out of the institute or out of the department?
Sir, we would need the external preceptors basically for those electives where we want to put the students outside the institute, maybe, right? Or maybe
But
we are doing.
sorry to interrupt, but my query is based on, because my topic was PMR, physical medicine and rehabilitation, and I need to include College of Physiotherapy in that case,
Exactly,
because
they will
that is
be your external preceptors.
yeah,
for your,
they will be my
yeah.
external preceptors then.
Exactly,
Yeah. Okay.
exactly. But then you will have to make sure, because the student will be going to the external preceptor for daily training. So that
Maybe
external,
that depends upon how we plan,
how you
but
plan.
I have to mention them beforehand,
Yeah,
because
so
external
you have
perception
to
is
include
required.
them. You have to
Yeah,
include them in the module.
because it's required. Yeah, thank
Yes.
you, thank you.
Good afternoon, everyone. Progressing further to the electives in block 2. Now, block 2 is the time period.
Screen is not visible.
Screen is not visible. Okay. Okay. I hope now it is.
Yes, ma'am, now it has come.
So block 2 is the time period of MBBS when they have just finished their MBBS part 1 examination, and that is before start of part 2 of third professional MBBS. That is the time period of block 2 when they will be offered electives. And duration of elective in block 2 is 4 weeks. And what is the purpose of electives in block 2? This is to provide the learner an explorative experience with guided patient care in a specialty of choice. So electives in block 2 can be mostly in the clinical departments, including specialties, super specialties, ICU, blood bank, emergency department, or from the list of electives developed and available at the institution. Or it can be a supervised learning experience at rural or urban community clinic. So this is just a repetition, so I'll not go into much details of this, because we all know that there will be no regular clinical posting during block 2. Whenever students are posted for 4 weeks in any specialty as a elective posting, there will be no regular clinical posting during that 1 month. And they 75% of attendance in electives is mandatory. That will be a prerequisite for them to sit during their final professional summative examination. Whether electives out of the institution will be offered, or whether electives out of the state or city will be offered, that will be decided by the higher authorities of the institution itself. So I'll straight away come to the example of elective for emergency medicine department. I have made an elective for emergency medicine. So I would like to start the elective as emergency medicine, a fast-paced and a dynamic specialty that offers the learner a unique clinical environment combined with strong teaching culture to enable them to consolidate and enhance their clinical skills before entering into clinical practice, just to make them aware what they will be gaining once they join the elective for emergency medicine. So this is how we will develop our module for emergency medicine. Name of block is block 2. Name of elective is emergency medicine. Location of hospital, lab or research facility. This is Department of Emergency Medicine, ground floor, hospital building, AIMSR, Bathinda. Name of internal preceptor, here I have written only my name, Dr. Upinder, or we can write all the 3 faculties available in our department. Name of external preceptor, if any, it's not applicable in our case. Learning objectives of the electives in emergency medicine. So a learner at the end of 4 weeks posting in emergency medicine should be able to secure an intravenous cannula and start an intravenous fluid infusion independently, to draw venous blood and collect in appropriate vials for hematological and biochemical testing, to draw blood aseptically for blood culture, to elicit and document the history and perform relevant physical examination in a patient presenting to EMR with acute chest pain. I mean, these are the few of the learning objectives that I would like my student should be fulfilling these, and he should be learning, his learning should be centered around these objectives. And he should be able to elicit and document history and perform relevant physical examination in a patient presenting to emergency medicine with acute abdominal pain, to resuscitate a patient in shock after trauma or burns, to conduct basic life support according to AHA guidelines, to communicate to the relatives of the patient regarding prognosis of the patient, to seek and document the consent for various procedures in emergency, such as blood and blood product transfusion, intubation, ICD insertion, CVP cannulation. So similarly, we can make learning objectives in our department that we want our learner should be achieving in those 4 weeks period. And number of students that can be accommodated in our elective for one faculty will be 4. Now, prerequisite for electives. So like in my case, students will be coming to the clinical side, and they will be exposed to various health problems also, like the incidence of hepatitis B and COVID-19 is still prevalent. So I would like to have them their necessary vaccination before coming for the electives. And they should have knowledge and practice of universal precautions while handling any HIV, HCV or HBs antigen positive patient. And they should be aware about biomedical, accurate biomedical waste disposal while working in a clinical areas. So this will be the prerequisite for them to do an elective in emergency. Similarly, you can make your own prerequisite while working in your own departments. So this is categorizing your objectives depending upon the learning domain, proficiency level, and educational strategies. So I have just given an example. So like mostly in my case, most of these are lying in a skill level. So we will be using the DOAP method of teaching them these skills. Now the list of activities in which students will participate, this will full 1 month schedule is given on the next slide. I'll go to that. Portfolio entries required. So I would like to have them all the case sheets of history and physical examination of patient with pain abdomen, pain chest as attached in the portfolio. Documentation of history and examination of patient whom they have resuscitated. Documentation of the patients on whom CPCR was done. And documentation of history of patients whose blood work was sent. So I want all these record sheets in the portfolio files. Every day, every activity during the day, whatever they are doing, they should be entered in the logbook with a with a date according to the date of the month, and logbook should be signed daily at the end of the day by the preceptor. Then assessment, we will plan the assessment like a formative assessment. One thing is we will like to make sure that they are making their logbook entries daily, and we will be checking their portfolios also. And then we will be assessing their skills by DOPS for clinical skills. And then we will be asking them to do a case presentation as a mini CX, mini clinical examination further to assess their case presentation skills. So this is the list of activities in which students will participate during 1 month. On like I have made it date wise, considering that our elective will start on 1st of February. So on 1st of February, that is first day of their elective, I would like to give them an orientation to the working environment to make them acquaint with EMOs, nursing staff, and whosoever is working in the emergency department. They will be briefed about the universal precautions while handling the patients and other biological material, and how to dispose of the biomedical waste which is generated while attending to the patients. So first day of their posting will be about the orientation. Then from the 2nd of February to 7th of February, they will observe and assist in eliciting history-taking physical examination of the patients presenting to EMR. They will document the history and physical examination in the record sheet and keep in portfolios. And for the next 6 days, they will observe and assist in securing intravenous lines, starting IV fluids, venipuncture and aspiration of blood for sampling, collection of blood sample for blood culture, and urinary bladder catheterization. I have in bracket, I have written the minimum number of times they should observe and assist in doing each skill. Then in the next week, they will observe and assist in resuscitation of the patient in shock, at least one patient they should be, and they should be able to do BLS, basic life support of a arrested patient, at least one patient, and they should observe and assist in at least minimum 2 intubations. And during the next week, they will observe and assist in communication with the patient's relatives regarding the prognosis of the patients. And they will communicate regarding getting consent for the procedures like blood transfusion, ICD insertion. And they will observe and assist in interpretation of ECGs, at least 2 ECG, interpretation of chest X-ray, and interpretation of the blood reports. And procedure of ICD insertion, they should observe and assist during last 5 days. Then the last day of their posting, I have kept for their assessment. So we will plan assessment to assess their cognitive domain also by taking a 10 MCQ based paper. And then to assess their history taking and clinical skills, I'll take mini CX. And for the procedural skills, we will do the DOPS, that is direct observation of the procedural skills. And then we would like to take the evaluation of the program. So I would like to take the feedback from the students, from the staff, from the EMOs as well, to know about the what went well during their this posting and how we can improve upon this program further. As Dr. Tanveer has asked, we can later do the qualitative analysis of this feedback, whatever we will get from the students as well as from the faculty. And submission of logbooks and portfolio will be done on the final day of their posting itself. So, so that nothing is left for the, like, they'll come you after 2 months getting your logbook signed and delaying the things. So that is why we would like to give each and everything that we expect them to do during in the published module for elective, so that they know at the start of their posting that this is expected from them, and so that they are doing it very regularly, and preceptor is also aware of their progress, whatever they are doing during their stay in the department. Now, the another important concern when students are coming to us in the clinical areas is their student safety. Because students are coming to the clinical areas, they will be handling the patients for the first time. So they can handle, maybe they can make themselves prone to infections while attending to HIV positive patients or HBS or HCV positive patients without wearing gloves or without taking proper universal precautions. So we have to take care of the student safety. So they should be oriented about universal safety precautions before starting their posting. And moreover, any rotation during which students can be exposed to potential hazard situations, they can be avoided, because students will work under supervision of preceptor. Preceptor should be available for guiding the student throughout the time of posting. So students should be supervised throughout 4 weeks. So preferably students should be posted during the regular duty hours in the department, rather than putting them in night duties when we are not available, when preceptor is not available, and when we don't know whether student is just coming from the hostel to attend the electives, but he is not coming to the hospital itself. So that way safety of the students can be compromised. So while planning while developing the electives, we have to keep this one point of student safety also in our mind. So this is just an example how we can develop modules for elective in our clinical departments. So any queries or questions are welcome.
Thank you, Dr. Upinder. Now, for the last note of the most important things, we will give the hosting rights to Sir, Principal Sir.
Thank you, Dr. Tanveer. Am I audible?
Yes.
Thank you. Actually, I must thank all the presenters first of all. It was very nice presentations by all of them, starting from GMER regulations, then going through template of the module, and then sharing modules, and before that actually covering our plan of action also, how we are doing it, what aspects we have already covered, and how we are going to implement it further, that plan. Now I have been given an what I will say duty to summarize the things. At Punjab ch na ek hai kehne male ਜਦੋਂ ਜਾਣ ਵਾਲਾ ਹੁੰਦਾ ਨਾ, ਉਹਨੂੰ ਘਰ ਦੇ ਬੁੱਢੇ ਨੂੰ ਉਠਾ ਲੈਂਦੇ, ਬਾਬਾ ਉੱਠੋ ਨਾ, ਮੇਲ ਨੂੰ ਆਸ਼ੀਰਵਾਦ ਦੇ ਦੇ, ਜਾਣ ਲੱਗੇ ਸਾਰੇ. So that responsibility probably has been given to me, and actually I was very pleased to see the developed modules one by the community medicine department and one by the department of emergency medicine, very nicely built. And now we don't have any blank document to show that it is how the modules can be developed. We have fully developed 2 modules. They have been shared, and I believe other preceptors that they will be able to develop their own. We are calling it module. You must have seen that the template which Dr. Mandeep shared, that was actually template of recording the learning experiences. But we are saying that from that you develop a मैं ले ला पता भी तेनों मैं ले आया फिर अंदर बड़ी दुनिया आने but what we are actually asking, what we are developing is a module. Why actually we are saying that you should develop a module and not a learning experience template. One template development will not give you that feeling of ownership. When you develop a module, that gives you a satisfaction and that gives you a feeling of ownership that yes, I have developed a module. Something big I have achieved. And second thing, we have already developed 2 modules. One was developed earlier by me, which was on medical ethics, and second by Dr. Tanveer on research methodology. Both of them, they have already been published in the form of booklet. And who knows that when you develop a module and enlarge it, it is also developed as a booklet also. Another thing, might be other universities, they can adapt a module which you develop. Who knows? So that's why we are asking you to develop a module, not the learning experience templates or that simple one-page form itself. Now, another point which I was asked actually was, and one thing more, I will actually request all of you, although it is not in learning experience template, the competency, but I will actually ask all of you that based upon your module which you are going to have, which you are going to develop, you must actually identify the competency which you are going to target. It might not be in the curriculum. It will not be actually in the curriculum, but what competency or how competent you want your students to be, that should be mentioned, and then you should develop the learning objectives. And if you can learn the learning objectives as per the template which was shown at the end by Dr. Tanveer, that will be a very beautiful idea. Although simply mentioning it will be sufficient, but if you can develop it in such a way that you mention the learning objectives and then you mention that to which domain they belong to and how you will plan for their achievement, that will be a very good idea. Portfolios, in every module there should be opportunity for portfolio. And now portfolio actually is something which is an evidence of record or an evidence. Like there will a logbook will be developed by curriculum committee. In the logbook there will be entries only by the students that I have done these kind of things. So how portfolio differs from that logbook is simply that students, they will have also record of those activities. That if I am saying I did this, I have this evidence to show that this is the evidence that I did. So portfolio must be there. And another thing in the clinicals, Dr. Upendra has shown that a minimum number of times that students will do it, that must also be mentioned in your module, whatever you try. Another thing which I was asked to share about was curricular governance about the electives. Actually, Dr. Upasana, she also mentioned about curricular governance in her slides. 2 slides were of curricular governance. So I will also share something, although much part of curricular governance has already been shared.
The participants can unmute themselves and they can ask the questions.
If you have any question for any of the faculty members, resource persons, any clarification still needed. So either you have clarified everything or nothing is actually clear. So in that case, should we end?
Actually, it's very well explained. बहुत ही बढ़िया explain किया हुआ है. Very simple language and very detailed explanations. So I think everything is well cleared now.
So we will be waiting for the modules now in next week.
Yes.
No, they are giving us a time period of 1 month, sir.
Yeah, 1 month.
क्या पूरा दे रही हूँ?
I mean the kind of preparedness we can expect in next week.
Ma'am, I have a question. हम अगर लिखते हैं prerequisites for electives, like हम कहते हैं कि awareness of good lab practices, suppose, तो हम वो जज कैसे करेंगे जब स्टूडेंट्स की हम काउंसलिंग कर रहे हैं, तो वो अवेयरनेस कैसे जज होगी उनकी कि गुड लाइफ प्रैक्टिस?
मैम, आई हैव ए क्वेश्चन, बिकॉज मैंने अपने डिपार्टमेंट के लिए सोचा है कि आई विल डेवलप अ क्वेश्चनर. मैं 10 नंबर का एक क्वेश्चनर डेवलप करूंगी जिसमें बायोमेडिकल वेस्ट का और यूनिवर्सल प्रिकॉशंस का, गुड क्लिनिकल प्रैक्टिस के 10 क्वेश्चंस होंगे. तो पहले दिन हम ओरिएंटेशन देंगे उनको, मतलब जा तो हम शुरू के बैच में ये कर सकते हैं कि सबको दे दो, जिन्होंने उसमें से एटलीस्ट 7 मार्क्स अटेन किए उनको हम क्लिनिकल एरिया में आने देंगे.
So this questionnaire you will administer at what time?
At the time of counseling.
एट द टाइम ऑफ काउंसलिंग. मैं अपने मॉड्यूल के साथ अटैच करूंगी ये. मैं अपने मॉड्यूल के साथ अटैच करूंगी. मतलब
हाँ जी सर.
Say the student scoring goes to below expectations at the end of the course, then
Yes.
what will you do?
हाँ, ये it's actually very nice question, and we don't have any answer to
I
it
was
right
waiting for this question.
now. We don't have any answer to it right now.
Because you don't have time further to repeat it.
repeat.
Yes.
Yeah.
We don't have any answer to it, sir. Because there are many things in NMC regulations which actually raises question, but answer अभी तक भी मुझे भी नहीं मिले. जैसे मेरा सबसे बड़ा तो वो प्रॉब्लम है कि they are saying in block 1 there will be clinical sessions, clinical classes, they will be held. Now in the whole this guide जो है NMC का regulations, it's written clinicals electives में portion में दिए हुए हैं 4 weeks, लेकिन वो to which department those 4 weeks belongs कहीं mention नहीं है. तो वो 4 weeks लगवाने कहाँ पे हैं? Not clarified. मैंने बड़ों से पूछा, वो कहते हैं यहाँ लग रही हो. लग कहाँ रही हो? लगानी तो हमने उस टाइम पे है. So ऐसे बहुत से क्वेश्चंस हैं सर जिसका कोई आंसर नहीं है. Because electives, अब जहाँ तो ये है कि आपने उन्हें मतलब वो कर दिया कि वो below expectation है, that means they will repeat it, and that means कि वो आगे they will not be promoted to final part 2 till they complete electives. But we actually have what we have planned is that we will definitely ask this NMC कि आप इस पे clarification दो. But all said and because 75% attendance भी है, अगर 75% attendance नहीं होती तो उनको फिर भी repeat करवाना. Because I know जब मैं उनसे ये पूछूंगा कि below expectation है तो क्या करना है, तो मेरे को आंसर ये मिलेगा जो मैं आपको देने वाला हूँ कि उन्होंने summative assessment कहा ही नहीं. That assessment in module is a formative assessment, not summative assessment. So we cannot make a decision कि below expectation है तो उनको रोक लो because of that below expectations, because this is not a summative question. So उस basis पे तो हम नहीं रोक पाते. लेकिन उससे बड़ी problem ये है कि अगर 75% attendance से कम है तो क्या वो they will not be allowed to appear in final part 2? Then how will they complete that elective and when they will complete?
Yes.
That is a more contentious issue because summative assessment तो हमने करनी नहीं है.
What will be the time schedule for our block 2? Time मतलब time will be like the hospital timings 9 to 4.
सर वो तो पूरा वही timing same.
They will attend for the full day.
नहीं, ऐसा नहीं है, not for full day. मतलब उसमें हाँ उन्होंने और कुछ नहीं करना है, लेकिन ऐसा भी नहीं होता है कि उन्होंने जब हम किसी को कहीं पे साथ में अटैच करते हैं अप्रेंटिस तो वो पूरा दिन मतलब, but it's good अगर वो आपके साथ सारा दिन रहता है तो.
But the clinicians may have problem to attend them for the whole day. ना that is the problem.
वो आपने decide करना है. There are many things which will which preceptor will decide when.
Because we can then decide the days in which we can attend them fully and we can decide time to.
कुछ नहीं कि सारे दिन की एक्टिविटी होएगी उनकी ना.
Yes. Yeah, right sir. Thank you.
So adding to that, for block 1, the students would be coming from 8 to 10, like
Yeah.
if we talk about our college, and then 2 to 4, because 10 to 1, they will have clinical postings, as mentioned till now. But we'll see what happens further. For block 2, they will be with you for the whole day, I mean 8 to 4.
Yes.
So that you can decide how you are going to put them up. Any more questions or comments? So we also want, we also have made these modules for the first time, in fact, in just a few days, because Dr. Pinder and me were preparing for giving the examples. So we would
Please share the modules on the group. That will be very helpful, ma'am.
That is what I was saying.
Dr. Pinder too, and ma'am, yours module was excellent. Perhaps that can guide us to large extent.
We'll surely share those modules, but that is what I was about to tell, that they are not the perfect modules. They are just a beginning.
No, but we found them more than perfect. अगर हम ऐसा बना दें तो हम तो बड़े खुश
I still need to improvise a lot because I was not well, so I made very hurriedly.
Sir, one more question. If we are giving 2 months for elective modules, will this be subtracted from the training for the final 2 months?
Dr. Nilesh, if you go through the whole NMC, those time schedule, already they have given 2 separate months for electives only. Now with the CBME batch, there is at the time of admission, there is 1 month separate for foundation course. After that, 12 months for MBBS phase 1, and then full 1 month separately for exams. They have separately given exam time also, and 2 separate months for electives itself. They will not be counted for final part 2. Now all phases, phase 1, 2, 3, 4, they are of 12 months except phase 2, that is of 11 months. So ye ban gaye 47 weeks. 1 week is of what I will say foundation course, 48 weeks. Then 1 week, 1 month. So 48 months ho gaye. Or 4 months are for exams, 52 months, and 2 months are for electives, 54 months. So 4 years, 6 months. Clear?
So there is question from me, sir.
Okay.
So this Dr. Pasna has said that one of the point was that if some student wants to go out of the institution, as it is very evident, once the student reads this document, they will say, "Sir, हमने तो बाहर करना है."
Sir, it is up to the college to allow or not to allow. हम allow ही नहीं कर रहे.
That has been that authority has been kept with the institution, sir.
Yes, sir.
Yes.
That's fine.
So the SOPs will be formulated, that how the allocation will happen. And also there's another point, that outside the institute, student will go only if that facility is not available in our institute. And by and large, we can see now that most of the facilities we are having, better than most of the other colleges. We have all the super specialty branches, and even here the molecular biology lab and other things. So I don't think at present we are not in in a phase of sending the students outside, and that also can be done only in the block 2 postings, because block 1 the students are going to be there for the clinical postings also, so they cannot come and go every time. So
no, it was not only for academic purpose or facility wise. People have got other interests also. मैंने तो जाके करी करनी है. So that was my issue.
No, sir. We are not allowing.
We are not allowing.
Thank you, sir.
So we leave, I believe. Thank you.
So thank you. Thank you, sir. Hanji, thank you, sir. Thanks a lot to all the participants also for being so patient and finishing right on time. at 4 o'clock.
Thank you.
all. Thank you, sir.
Ma'am. Thank you, sir.
Thank you, sir.
Thank you.